Let's focus on the 2025 release of NextGen's Gastro suite. All right, let's dive into quick order configuration. We are on the SOAP panel. We are already expanding the panel for quick orders. We're on the SOAP template, we're on the quick orders panel. We're going to describe how these quick orders are created. We have a quick order with additional notes, and we have a quick order that can have multiple orders tied to them. To configure quick orders, you need to open File System Practice Templates. Now go to the Specialty Configuration homepage, and here along the left side, you'll find quick orders. I'm going to go ahead and do a right-click up here, and I'm going to set these to a vertical tab group so we can see them side by side. I'm going to scroll down to the section that we're really configuring right here. This category that the providers see is linked to what categories we designate to each order. If I open an order up, here is your category listing. Anytime you want to add a new category, you simply type a new name and it will become a new category. The description is what is presented here. That can actually be different than what goes into the order. So shorthand is fine here, but you want something a little more verbose here. You put it here. When I highlight the order, I can also indicate if the primary order should go in as complete. Education often is like that. It can go in as complete. NextGen uses a concept to hold orders with some pre-canned information or predefined areas, so for later filter sorting. So depending on the department that you want to create the order for and what class tends to be the most required, this will group your orders. If they're procedure instruction, we'll see more of that as we make more orders. Subclasses less used, we can drive a CPT code for this order and a modifier. You can also define laterality and location, and if it's administrating a J-code drug, we can talk about the dose units, routes, and the meds around it. You can also do disable order, and what that allows you to do is really launch other items that can be tied to clicking over here without really placing an order. It's very powerful. So if you want to just have something that generates tasks or adds medication, you can have an order that says, add a certain medication, disable the order. You're not going to need to instruct any one actionable order because the provider's already done it either through directly adding the medication using quick orders or sending task. Time frame. If you want to adjust this time frame, let us know. This is something that's integrated in the back system, the additional notes there. Now let's move down here. Let's talk about the additional order for a second. The additional order is a second quick order. Another order that would go in here without having to create an order set. So you always have the option to tie on a second order. This is really common if the order that you're placing. You also want to specify some completed education you did around that order. When the provider orders a particular study, they may also want to document that they had a discussion with the patient. Third is tasking. This grid holds multiple tasks you can generate off this order. This task layout is very similar to a quick task, which includes rules that can automatically directed to the correct revipent by location or provider, or a combination of both. You have your groups, and if you scroll down, you have your users. In addition, you can insert variables. If I want in the message the order name here to go into the description, you can do that, or the current provider that's ordering it. You can do both of these items in the subject and message. This works very nicely for pre-cert. So not only does pre-cert get tasked, they get tasked the exact order description and the provider that's ordering it. And with rules, the task will be directed to the correct staff. All happening in the background, the provider doesn't need to be slowed down by the background process to support his or her practice. So make sure when you build your task, press Add. You can add a medication. When medications are added, NextGen's advanced drug-to-drug, drug-to-allergy checking is invoked based on the practice's setup. You can look up the brand, and you can look it up by generic as well. Just make sure that you complete all the necessary components of quantity, refills, and your SIG description. You can add multiple meds. All meds will be added with the provider's click of the order. Let's look at options of the order. Options include the ability to always expand with one-click ordering prompt for time frame. What does that mean over here? Providers demand less clicks, so if in their workflow, it's common for them to not want to press this place order, they can turn on one-click order. That means after they have the order set, whenever they click in the order automatically goes without them hitting place. Order. But sometimes they have one click turned on and they forget to tell the practice the time frame. So for a particular order, you can always prompt for time frame. If we know a particular order is more complicated and we need them to slow down and look closer at an order, we can even disable one click. This feature is no longer needed as the regulations for appropriate use criteria has been delayed. Inaditin can always prompt with provider, so if for some reason they did not specify who they want the particular order RO be addressed by, we can prompt the provider. A order may need more quick clarification. The practice can enable two lists to further define the order. So now you can have the flexibility of two custom lists tied to a single order. In addition, you could generate a document automatically offline. A great use case is generating patient education. We could launch another template pop-up in case there's some ask and order entry questions or some additional items that we want a provider to fill out. We could launch a whole template. We could run what's called a stored procedure, which is a technical term for allowing with a single click many things that happen in the background to update data for the patient or across the practice. We can override the diagnosis, so in case they're ordering a routine colonoscopy while seeing them in the office for another condition that we diagnose the patient, the order could contain the common codes for the procedures. And lastly, there's a default overall comment that would go into this comment box.